Hello, I'm Dr. Fakhoury of the Fakhoury Medical and Chiropractic Clinic. I brought my chiropractic first book, and I also brought my good friend, Jose. Jose and I are going to help tell you a little bit about the clinic and about our history. So we started in 1985, one employee, and waiting for that first patient to walk into the door. We were over by Monroe Hospital, and we were there for about 1.5 years. And from there, then we moved to a new location, added on some more staff members, added on an additional chiropractor also. And so as we were treating patients over the years, we noticed the patients would come in and say, you know, Dr. Fakhoury, I was doing really well until I had this accident. Ever since this accident, I had headaches. Ever since this accident, my muscles are always tight. Ever since this accident, my arm goes numb. And we thought, you know what? Maybe we're catching this a little too late. Maybe we need to catch it earlier on after the trauma happens, because we found out that people are going to heal no matter what. They're either going to heal good or bad. Unaddressed, they're going to heal poorly. So we started focusing the Fakhoury Chiropractic Clinic back then on treatment of accident injury. Of course, we take care of all patients, those that maybe twist their back, sleep wrong, dig the wrong way, or if they get in an accident. But we focus mostly on those patients that were in accidents, because if we take care of those people and help them to heal well, then they'll have less residual problems in the future. So we focused our chiropractic care on that. And then people were saying, you know, Doc, I feel great, but I still have this spasm. So we decided, let's add massage therapy to the Fakhoury Chiropractic Center. And we did. We brought in massage therapists. The patient said, you know, Doc, I feel great until I walk out, and by the time I get to my car, I feel like it slips back out. So we said, you know what, let's add rehab to the Fakhoury Chiropractic Clinic, and so that way we can strengthen and stabilize the spine to hold adjustments longer, massage therapy to relax the muscles. And we did that. Patients loved that. But then we started getting more complex cases coming in, and we thought, you know, we better bring an urgent care trained medical doctor on staff, and we brought Dr. Shanawani on board. And then we converted and became a new clinic, Fakhoury Medical and Chiropractic Center. So we became a multidisciplinary clinic being focused on trauma care, but able to help all types of musculoskeletal problems. Let's talk about chiropractic though. What does chiro means? Hands. Practic means the practice. So we practice with our hands. Through gentle techniques, we realign the vertebrae in the spine, take pressure off the nerves that feed every part of your body, so that way there's less pressure on the nerve. That may help the numbness in the arm. It may help the sciatic pain. It may help the headache. Maybe even the stomach pain, because that nerve goes to the stomach also. And so going back to our accident patients, how we take care of them. So our urgent care trained doctor will evaluate them. Chiropractically, we'll treat them. But some cases, because there's some severe trauma, twisting, turning, some damage possibly to the disc, maybe a disc herniation has occurred. And we have patients that just don't quite respond to conservative management. So we brought on some other team members. We brought on an anesthesiologist that does injections. So this is for the more severe cases where they have unrelenting pain in the arm or leg that's disturbing their life and their function. And so what we do is within our office also, in a multidisciplinary approach, we do facet blocks, epidural injections, and a technique called radiofrequency ablation to try to help those patients. Now let's not forget that when you're in an accident, the brain really goes back and forth and sometimes hits that skull. And then you get that counter-coup type injury, which can leave with dizziness, headaches, ringing of the ears, forgetfulness, memory loss, difficulty with speech. And so these post-traumatic brain type injuries can't be evaluated by a chiropractor, can't even be evaluated by an urgent care doctor. So what we did is we brought on a cognitive evaluator. And Mindy Phelps is amazing, because she can get into the head, understand why that person is experiencing that, explain it to the person, tell them what to expect, and give them exercises to help them. Other patients come in and their pain is going down in the arm or their leg, and we want to find out, is this related to the accident? Is it new? Is it old? Is it just pain, or is there damage that's occurring? If it's damage, it's very important for us to know. So in the office, we have a physiatrist, which is a medical doctor that's board certified in a specialty, to be able to do nerve testing on the arms and legs to tell us, is that disc herniation damaging the nerve where it could be permanent? And if we find that they failed the epidural injections, If they do have permanent damage that's occurring to the nerve, then that's important. Then we need to know that they failed conservative care, and this might be that small percentage, that 5% that might need a surgical evaluation. And in the office, we have a fantastic spine surgeon that has done 8,000 studies and is just excellent. He does the microsurgery, very safe, very effective, same day, and you're out, and then you're usually at work within 24 to 48 hours. So he evaluates patients that are in the more severe cases where they failed the conservative care, they do have nerve damage, they didn't do well with the epidural, and all that is within our office. So what we are is a multidisciplinary clinic, one facility that has all these specialties within it to be able to help your friends, family, loved ones that are having pain or injury from the accident. Sometimes people get in an accident and they don't think that they're hurt. They think it's just a little sore, but the problem is that shows up 6 months to 2 years later as pain that is intense. And by the time they come in, it's really healed badly. So we encourage people that if they're in an accident, get in. Next question is, should I go to the hospital? If it's broken or bleeding, yes, go to the hospital. But if not, our urgent care trained medical doctor is capable of being able to take care of that faster, more efficiently, and more cost effectively. So God forbid, but if your friend's family, loved one is in an accident, please call my wife, Manal, call myself on our cell numbers. We'll get that person in immediately the same day, start the treatment, help them to heal and recover from their injuries, and be able to give them the love and care that they deserve. And thank you very much for joining us. And this is Fakhoury at the Fakhoury Medical and Chiropractic Center.